So, continuing our discussion on the medical implications of the problems in the metabolism of these conjugated carbohydrates. Now, let's move from the GAGs towards the glycoproteins. Glycoproteins, as you know, are not very different from the proteoglycans. They are actually same in the sense that they are composed of proteins and the carbohydrates, though the glycoproteins are smaller in size. But you will see that the problems which occur because of the impairment of the metabolism of glycoproteins is not very different than the problems you have seen in case of GAGs. So one of the characteristics, some of the characteristics, as was in the case of GAGs, that the glycoprotein disorders or disorders related with the glycoprotein occur because of the deficiency in the enzymes which are present in the lysosomes. So as a result of this, these proteins get accumulated in their undegraded, undigested or partially digested form into the lysosomes, which have all sorts of medical or clinical implications. So defects in the enzymes can be, one of the biggest reasons again is that they are genetic in nature, genetic mutations in the enzyme. As I have already told you that a genetic mutation in the enzyme will lead to hereditary disease. Enzyme deficiency occur because of it can occur actually because of the mutation in the gene which is encoding that enzyme, or it can occur also in the mutation of a gene which is encoding an enzyme which is responsible for somehow the formation of the enzymes of the lysosome. The clinical symptoms, as was the case in the GAGs, they involve skeletal muscle deformities, they involve the neurological disorders, they involve the immune system disorder, and so on and so forth. Some of the compounds are involved or which are implicated in this disease are it's not difficult for you to know what could be those compounds. Of course, these will be the residues of the glycoproteins, which will, if they are not well metabolized, then they will give rise to a specific disease. So one example here is acidosis, which occur because of the deficiency in the neuraminidase. As a result of this, there is accumulation of neuraminic acid. Do you know neuraminic acid? What is it? It's a very important component of the glycoproteins. Similarly, there is a mucolipidosis type 2 and type 3. As I already told you, the eye cell disease, which occur because of the fact that the enzymes which are involved in the phosphorylation of the glycoproteins, for instance, for the mannose residues, they are very important because this phosphorylation then direct these proteins towards lysosome. So what will happen that if that phosphorylation is not occurring well, what will happen? Then these will be accumulated into lysosome, and lysosome will be turned into inclusion bodies. So, and that will affect your whole body. Then alpha mannosidosis, deficiency in alpha mannosides, यानी ये वो एंजाइम जो कि मैनोस की अल्फा मैनोस की डिग्रेडेशन करता है, उसकी डेफिशिएंसी से ये बीमारी होती है. Then there are similar type of diseases which occur because of the deficiency or defects in the synthesis of enzymes which are involved in the metabolism of compounds like beta-mannose, which, and the disease is beta-mannosidosis. Then fucose, L-fucose. If there is this problem in the degradation of L-fucose, it will lead to fucosidosis, and so on and so forth. So, in general, the enzymes which are involved in the degradation or metabolism of these glycoproteins or different residues of the glycoproteins, then if these enzymes get defected or they are deficient in the cells, then you will face a real clinical or medical implications. Then the symptoms, again, symptoms are not very different than symptoms you have seen in the case of GAGs, that there are what we say the skeletal muscle problems, then there are developmental delays, there is neurological disorders, intellectual disability. Because of the skeletal muscle problem, there is specific distinct facial features which can be easily examined by a doctor when he is examining the patient. So one of the diagnosis again is that diagnostic feature is that you can really see the facial deformities or different structural or problems which occur because of structural problem occur in the skeletal muscles. So you can really diagnose this on the basis of this visual examination also. But again, the visual examination is not always the most correct way to diagnose a disease. You have to go through chemical tests, and one is the urine test again, because we have been seeing that if a molecule is not being degraded well in the lysosome, it will be then excreted out in urine. तो उसमें यूरिन में भी आप इसको, अगर आपको ये प्रोटीन ज़्यादा मिल रही हैं, glycoproteins, it again shows that there is a problem in their degradation. Then there are enzyme assays, chemical tests, which will tell you that whether or not this degradation or metabolism of this molecule is happening well. Then, of course, finally there is genetic testing. We know that these diseases, or most of these, are hereditary. So you can also perform genetic tests. As far as treatments are concerned, we know, I mean, it's sort of, I mean, it's not something one have to say with any excitement. It's really something, okay, though medical science have really developed so much, but dealing with the hereditary disorders or metabolic disorders, it is still a challenge. We can manage it, and in some cases we manage very well. But at the end of the day, as far as cure is concerned, it's not really there. So enzyme replacement therapy, as I have already told you, in the case of GAGs metabolism, that you can replace the deficiency of the enzymes by administrating new enzymes. Then you can also do the stem cell transplantation, so that you come up with the cells which can produce those enzymes which are involved in the metabolism of these molecules. Then, of course, sometimes not given that seriousness, not taken as seriously as it should be, these supportive therapies like physical therapy, like occupational therapy, like speech therapy. In all these therapies, you talk with the patient, you console him or her, you advise him, or you give certain advices which are really very helpful. So in this way, not all the time administrating different high level of technological, what we say, giving the drugs or medicine, it's not all the time that it is useful. Sometimes even simple sort of strategies, like if you talk with the patient and teach him that how he can cope with the disease, that also is very helpful. Then there are symptomatic treatments also, of course, which are depend upon what sort of symptoms, what sort of severity a disease is causing. Then there is prognosis. Again, it depends upon the disease, it depends upon its severity, it depends upon how much time have taken. So it's always good that you really diagnose it on the earliest stage. That is with all the disease, but specifically for for chronic diseases, it's always important that somehow you manage to diagnose it at very early stage.